The mayor recently announced that all new recruits will get de-escalation training. And then on a voluntary basis, veteran officers can get what's called crisis intervention training. And the department now is standing up a unit, not unlike a SWAT team, if you will, that is trained and focused on intervening specifically in crisis intervention training. One of the questions that I think we're confronting in this time is really, what is the job of a police officer? And focusing on the mental health question, whether or not officers should have to deal with these issues. The practical reality is, should or not, they are. People in our community are suffering from mental health crises. They need the assistance, and sometimes they need the assistance that police officers can provide. So providing those police officers with the kind of training that they need is critically important. I think we have a unique opportunity in this time when there's a lot of focus on reform and accountability to really ask that fundamental question as a community and have a conversation around what our expectations are. While I believe that police officers need to be empathetic, they need to have the information to recognize different circumstances that they're going to confront on the street and the tools to be able to handle them, they are not mental health counselors. So we as a society need to make sure that we're making the right investments in the right ways so that police officers can do their job, which is specific but also limited. Police officers are the face of the government. They are the primary government actor that comes when called. So it is incumbent upon police officers to make sure that they have a whole range of tools in their toolkit to be able to deal with the kind of crises, calls, interventions that they are going to experience on a day-to-day basis, one of which clearly is mental health crises. That's why the training needs to be mandatory so that officers have a level of sensitivity around these issues and have the tools that they need to be able to handle them if they're confronted with them. In order to redirect citizens away from incarceration into treatment, there's a number of different things that have to happen. First and foremost, we need to make sure that we have sufficient community-based resources so that folks can get the kind of care that they need. That unfortunately hasn't been as big of a priority as it should be. We know that a number of mental health clinics were closed, but I think what the city ought to be focused on is leveraging its scarce resources to interact with private resources to make sure that we've got a seamless network of care so that folks don't have to travel great distances to be able to get treatment that they can afford. Many people have mental health challenges, and that has nothing to be ashamed of. Destigmatizing mental health should be a top priority for all of us. You need to be able to feel comfortable sharing with the 911 officer, for example, that the reason for your call is because somebody is experiencing a mental health crisis. That's deeply important because 911 operators take down the information, they give it to a dispatcher. The dispatcher then, based on the nature of the call, will assign particular officers to handle that call. So what this means is we need holistically to be working to get folks comfortable with recognizing that people are going to have mental health challenges. It's not a stigma, it's not something to be afraid of, but we still have more work to do on that.